The House will come to order. Reports from the Committee on Rules and Legislative Administration.
Long from the Committee on Rules and Legislative Administration, pursuant to Rule 1.21, designates the following bill to be placed on the calendar for the day for Friday, May 16, 2025, House File number 3321.
Motions and resolutions. I recognize a member from Dakota, Representative Bierman.
Thank you, Madam Speaker. It's my pleasure today to have a House resolution on behalf of Dr. Tony Barr, who is joining us here today in the upper level, and to recognize and introduce Dr. Barr as an internal medicine pediatrics physician, recognized for her dedication to medically complex children and their families by providing holistic, coordinated care. Today, COPIC and the Minnesota Medical Association are recognizing Dr. Barr as the 2024 COPIC Humanitarian Award recipient. This award is presented annually in honor of a physician for volunteering medical services and contributions to their community. The recipient of the award designates a $10,000 donation from COPIC, and as this year's award winner, Dr. Barr has chosen to direct her donation to support Gillette Children's. Please join me in congratulating her on this award. Thank you.
Calendar for the day. The first bill on the calendar for today is House File 2464. The Chief Clerk will report the bill.
House File number 2464, number 1 on the calendar for the day, an act relating to state government, modifying certain health and licensing provisions, the first engrossment.
There are amendments at the desk. If there's no objection, we will let the author explain the bill before we act on the amendments. I recognize the member from Traverse, the author of the bill, Representative Backer.
Thank you, Madam Speaker and members. This is a bipartisan bill. We worked on it extremely hard. Some of the high points of the bill is the sensitive exams, which we heard the other day on Monday, but that is also in this bill. We have the maternal death studies that conducts studies giving money to especially minority, why mothers die, why they're pregnant, really focuses on the minority mothers, which is very important. We also have a provision in this bill that makes it so it directs data about sex trafficking to us as legislators. And of course, that is a horrible crime, and it's important that we have that information so we can have the policies that can reverse that type of tragedy. Data study, and then we also have Safe Place, which allows mothers to drop off unwanted live babies without criminal penalizing. And then we also have an agreement between physicians and PAs, and we can't forget the optometry part of the bill. We know we've talked about this many times in this session. Very important, especially for my constituents who have to drive miles and miles to the Twin Cities if they are not able to get these type of health practices in the district. And then finally in the bill, we expand the higher ed facility authority to include healthcare facilities in bonding. It is a revenue bond, so when they pay it off, it's revenue back to the state. So it's really, as you can tell, it's neutral when it comes with finances. So with that, open to the amendments there, Madam Speaker.
There's an amendment at the desk. The clerk will report the amendment.
Bierman moves to amend House Bill number 2464, the first engrossment. The amendment is coded A13.
I recognize the member from Dakota, Representative Bierman, to explain the amendment.
Thank you, Madam Speaker. The A13 amendment brings important new language to the bill, updating the scope of practice for optometrists in the state of Minnesota. The expanded prescribing and procedures will improve eye care for all of your constituents. Members, I ask you to support the A13, and Madam Speaker, I would like a roll call, please.
A roll call has been requested. Seeing 15 hands, there will be a roll call. Discussion to the amendment. I recognize a member from Hennepin, Representative Nadeau.
Thank you, Madam Speaker, and I stand to also support this amendment. We've had a lot of discussions about optometry and ophthalmology over the past couple of years in this body. No one's worked harder than Representative Bierman to try to find that common ground that increases access to eye care patients, that increases availability of eye care doctors, and this finds that perfect spot for us to move forward in this particular bill. So, members, I recommend that we vote green on this amendment. Thank you, Madam Speaker.
Any further discussion to the amendment? Representative Bierman?
Please vote green. Thank you, Madam Speaker.
The clerk will take the roll. The clerk will close the roll. There being 133 ayes and 0 nays, the motion is passed and the amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
Bonner moves to amend House File number 2464. The first engrossment as amended. The amendment is coded A6.
I recognize the member from Hennepin, the author of the amendment, Representative Bonner.
Thank you, Madam Speaker. The A6 is a simple technical amendment provided by the Minnesota Management and Budget Department. They suggested that we remove some outdated language to make sure that employees' compensation for the organization continues to be allocated appropriately. And so it deletes some old language to make it a little bit more clear that their benefits should align. I urge members to vote green.
Any discussion to the amendment? I recognize a member from Traverse, Representative Backer.
I would agree, vote green on this amendment.
Any further discussion? Representative Bonner.
Oh, I was just going to ask for a roll call.
A roll call has been requested. Seeing 15 hands, there will be a roll call. Any further discussion? The clerk will take the roll. The clerk will close the roll. There being 133 ayes and 0 nays, the motion is passed and the amendment is adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 2464, as amended.
Third reading. Discussion to the bill as amended. I recognize the member from Dakota, Representative Bierman.
Thank you, Madam Speaker. Just wanted to comment on the bill itself. Pleasure to work with Chair Backer on this and the committee. Scope of practice with optometry and ophthalmology is just one of the many areas of scope that we need to focus on. In optometry, we should not be hesitant to make these improvements whenever we can. There is more work to do, but this bill before you today moves us a bit closer to what modern scope looks like, and I appreciate all of your support. The bill also keeps the oversight of the profession firmly under the guidance of the Board of Optometry in Minnesota. Members appreciate your support and would like to hear from Representative Gander here, and as the optometrist in the room, get your insights. Thank you.
I recognize the member from Polk, Representative Gander.
Thank you, Madam Speaker. I rise in support of HF 2464 as amended. I've practiced optometry for 38 years and have witnessed tremendous advancements both in treatment and in patient outcomes during that time. It's a privilege to help bring these improvements to our patients. Optometric education is rigorous. It includes a year of human anatomy and cadaver study, over a year of ocular anatomy, a year of pathology, systemic and ocular pharmacology, clinical medicine, lab testing, and extensive training in ophthalmoscopy, slit lamp biomicroscopy, and advanced imaging. Optometry students also train in administering oral, topical, and injectable medications and perform a variety of procedures clinically. In recent years, I've attended continuing education courses on covering eyelid injections, including hands-on wet labs. Our current scope of practice limits us from performing these procedures in a clinical setting at this time. Optometrists routinely perform procedures that align very closely, though, with those being proposed. I've drained sebaceous cysts and hordeola from eyelids using sterile hypodermic needles, removed various corneal foreign bodies. Administering anesthetic and removing a chalazion is a logical extension of these procedures. The field of eye care faces significant workforce challenges. In Grand Forks, East Grand Forks, where I practice, historically we've had 5 to 7 ophthalmologists. Currently we have 1. That is a big, big challenge for all of us. It creates long patient wait times and provider strain. Expanding the scope for optometrists to perform these minor eyelid procedures will ease this burden and improve access to care. It's important to note that in our communities, optometrists and ophthalmologists get along famously. We collaborate very well. We co-manage patients every single day. I've removed many sutures after eyelid procedures and routinely provide pre- and post-operative cataract removal care and LASIK care, all closely in harmony with ophthalmology. These conflicts only arise typically in the political process, not in clinical practice. So I believe that this scope adjustment is in the best interest of patient care and ultimately will be embraced by all of the practitioners involved. So co-chairs Bierman and Backer, thank you for your efforts to find balanced solutions. Representative Nadeau, thank you for for your persistent support over the years. It's been invaluable. While several revisions will still need to be made in the conference committee, I'm confident that common ground will be found. Thank you, Madam Speaker.
Further discussion to the bill? I recognize the author, Representative Backer.
Thank you, Madam Speaker. And members, want to thank all who helped us, staff, and our committee members on both sides. So we had a robust debate and discussion in committee. So it's been an honor to serve as your co-chair. So with that, vote green.
The clerk will take the roll. The clerk will close the roll. There being 134 ayes and 0 nays, the bill is passed as amended and its title is agreed to. Motions and resolutions. There are copies of the non-controversial motions at the House desk and online. If there is no objection, we will act on these motions first. Hearing no objection, the motions prevail.
NISCA introduces House Concurrent Resolution Number 2, a House Concurrent Resolution relating to adjournment of the House and Senate until 2026. The concurrent resolution is being referred to the Committee on Rules and Legislative Administration.
Announcements. Representative Niska.
Thank you, Madam Speaker. I move that when the House adjourns today, it adjourns until 11 a.m. Friday, May 16, 2025.
Representative Niska moves that when the House adjourns today, it adjourns until 11 a.m. Friday, May 16th, 2025. All those in favor say aye. Those opposed, nay. The motion prevails. Representative Niska.
I move that the House do now adjourn.
Representative Niska moves that the House do now adjourn. All those in favor say aye. Those opposed, nay. The motion prevails and the House stands adjourned until 11 a.m. Friday, May 16th, 2025.